Hey guys, so this is a really important topic that we need to talk about today. It's called basically chronic pelvic pain syndrome or non-bacterial prostatitis. The reason is this is coming up more and more, and it actually ties into heart flaccid quite a bit, and it can be a major side effect that, according to these papers, up to 50% of men in general can deal with, but especially those that are doing any kind of enlargement exercises are at risk of doing. And so we're going to break down multiple papers today and talk through it. This is not one of the most sexy ones, guys, but this is a very important topic that, I certainly hope you guys pay attention to because it could be you one day. So what we're going to be talking about today is called non-bacterial prostatitis, which is now basically known as chronic pelvic pain syndrome. How this presents is, in my experience, having clients, they will come to me and they will have inflammation basically in their taint area and problems with things like pain with ejaculation, problems with things like urination. But basically what this is you go to see a doctor and they run all of these tests and they're negative for any kinds of signs of sexually transmitted diseases and honestly even negative for things like white blood cells in the urine or in the semen, but they're having these symptoms that are consistent with a prostatitis. And for those of you that don't know, basically the prostate is one of the sex organs in men. It's like a walnut-shaped gland that is between the penis and the anus that's responsible for making some of especially the seminal fluid that comes out. And here you can see recent changes to the classification where now they have this type 3 classification, which they previously called non-bacterial prostatitis or even prostadinia. Now it is basically just this chronic pelvic pain syndrome. And once again, guys, one of the key markers of this is the absence of white blood cells, so little infection-fighting cells on any of the urine or any of the seminal fluids that they evaluate. But guys, this is like a multifactorial. There are many causes that are associated with this CPPS. You can see in this graph here, there's everything from sexual dysfunction. You can have muscle tenderness. You can have neurologic dysfunction. So things like erectile dysfunction. Sometimes you can't have basically infection of the area. There's a psychologic component and a urologic component. So there's all of these different things that can be a component of this chronic pelvic pain syndrome. And guys, one of the most important causes of this, which is one of the most important causes of male sexual dysfunction in general, is the pelvic floor. And I know I sound like a broken record talking about the importance of pelvic floor health, but guys, here is a perfect example of how pelvic floor hypertonicity or overcontraction can lead to this CPPS syndrome. Here's an excerpt from one of the doctor's websites that shows that basically it can be caused by the stress of tightening the muscles in the pelvis, okay, amongst other things. But it's very important to have a healthy pelvic floor. I had a client that was literally diagnosed with this. He thought the doctor diagnosed him with prostatitis. Then they did the workup and it was all negative. It turns out it was from this and it was related to his hypertonic pelvic floor, guys. So you need to be doing stretches and you need to be doing other things to keep your pelvic floor healthy. But other things that are relevant when it comes to especially any kind of enlargement exercises is either the absence of sex, the excess of sex, and physical stimulation in this area. So even things like bike riding, anybody that is using any kind of device that is putting pressure on that area during PE can lead to this syndrome. And once again, guys, there's conflicting evidence, but I've seen in this paper, they discuss that there's anywhere between 8% all the way up to 50% of men within that age group, typically it's less than 50, have presented with this CPPS syndrome before. Fortunately, most of the time it resolves with treatment. So once again, guys, symptoms include pain in the taint, pain with ejaculation, painful urination, feeling like there is something trapped within your urethra, irritating it. There's even these 4 elements that they determined in this paper that include basically perineal pain or lower abdominal discomfort. You can have infection or inflammatory changes of the prostate. You can have pain associated with the prostate, and then it basically appears with specific activities that induce it. Callie put up a graph from one of these papers here, but it talks about the different risk factors, okay? You all need to be doing everything you can if you're engaging with PE to minimize any of these risk factors, okay? So things like diet, there's certain types of things like alcohol, guys, coffee, hot pepper, spicy foods, and even excessive dieting that can make this more likely. Lifestyle, if you are sedentary, guys, I talk about on my channel the importance of exercise so much, but being sedentary, having a job where you're basically sitting all day can contribute to this prostadinia, this chronic pelvic pain syndrome. High stress, Jesus, there's very few people I think that are higher stress than me, especially right now. But even sexual habits, guys, things like delaying ejaculation, sexual abstinence, or even excessive sex or coitus interruptans, aka pulling out, guys, somehow that can all contribute to the chronic pelvic pain syndrome. And of course, things like perineal trauma, okay, where you could get hit in that area playing soccer, excessive bike riding, etc. So if you're at risk of any of these things, you're at risk of developing this syndrome. So you need to be very careful. So how is it diagnosed? Well, you need to see a doctor so they can do a thorough workup with you, okay? Typically, there's a physical exam that's going to be done. There might even be what we call a digital rectal exam, a DRE, where you actually use your finger to try to palpate the prostate, see if it's inflamed. Oftentimes, there's blood work that's performed, like checking your white blood cells, and then sometimes even checking a urine, especially, I would say, a full sexually transmitted disease panel to make sure that this isn't some STI, sexually transmitted infection. I don't think this is necessarily off the jump, but testing the seminal fluid, if you can, is something that's very helpful in diagnosing this. How do you treat it? Well, most importantly, guys, you need to try to get a feel for what do you think is causing it based on those risk factors we just talked about, and try to mitigate those risk factors. The number one thing that I would recommend, and this has been the case with both of my clients that have had this, is pelvic floor dysfunction. Number one, you need to start pelvic floor stretches, guys. I've made so many videos about the importance of pelvic health, especially my video. It's called Stop Doing Kegels. I'll put a link. But in that video, I talk about the importance of pelvic floor health and even go over my stretching routine, guys. Sometimes things like analgesics, like either Tylenol or ibuprofen, can help with some of that pain and discomfort, which can help temporarily relieve it. Alpha blockers, guys. Things that are going to basically block the signals to keep those pelvic floor muscles all tensed up, like doxazosin, okay, or tamsulosin, can be very helpful in both hard flaccid and in this to help blocking that sympathetic innervation. And so that's something that you could consider after meeting with your doctor. Hopefully they could potentially prescribe that for you. Antibiotics are often given in this situation, but guys, I'll be honest with you, antibiotics don't particularly help, okay? Why is that? Because this is, by definition, non-bacterial prostatitis. So treating something that's going to treat bacteria when there's no bacteria involved is not going to help. But unfortunately, providers like to prescribe antibiotics, and there's a high likelihood that they will basically give you a test run of antibiotics to see if it helps. It almost never, I won't say almost never does, because the placebo effect is up to 1 in 5. And so I'd say maybe in about 1 in 5 guys, just the psychological benefit of having a medication for this can help overcome some of the psychological component. Sometimes specific, basically antidepressants like duloxetine, fluoxetine, sertraline, okay, all of these things can actually help because of the effects on the CNS. They can help with some of the, once again, some of that sympathetic innervation, and they can help with some of the psychological component of, having this basically disease where you have pain in your taint and or erectile dysfunction, hard flaccid-like symptoms. And in this paper that I like that kind of summarized the treatment, I'm going to read some of this to you. It says, there are many approaches available in current practice, including alpha blockers, antimicrobials, antibiotics essentially, and anti-inflammatories, neuroleptics, antidepressants, physiotherapy, acupuncture, and shockwave therapy, physiotherapy, and others for pain relief should be considered within kind of that first line treatment, guys. So guys, another important thing to think about with treatment is psychological counseling, okay? They actually talk about a case report of a guy that had been dealing with these symptoms for over 2 years. He finally saw a psychiatrist or psychologist, I forget which one, but they actually talked through the issues and actually started him on some basically Chinese herbs that the patient believed in, and he did get relief. Within about 2 weeks after starting that medication, he had relief because he basically believed in it, but through the psychological counseling and working with the patient, that is helpful. So you should certainly consider that. So in my opinion, the first line therapy, which they discuss here, should be a combination with simple analgesics, something like Tylenol, ibuprofen, and or alpha adrenergic antagonists, okay, like alpha blockers like we just talked about, should be the staple of kind of a first line therapy when you're dealing with this. So things that you want to avoid, which can make things worse, combined antibiotic treatment, okay? It's not bacterial, guys. You don't need multiple different antibiotics to try to just blast this. It's not going to be helpful. Electric stimulation of the area, that's a no-no. Urethral infusion therapies, them trying to literally inject drugs into your urethra, your pee hole, no. And most importantly, surgeries. There's some papers that report that basically a TURP, which is basically a transurethral resection of the prostate, can be helpful. Guys, don't do that, especially if you're a younger guy. That should be an absolute last resort after you've had multiple different urologic appointments before you pursue anything like that. Fortunately, guys, outcomes for this, at least according to the research that I found, are pretty good. Most guys are able to at least dramatically improve their symptoms to the point where they have a good quality of life even if they don't ever technically like cure it 100%. Once again, guys, there's a lot of overlap between this and hard flaccid. If you don't know what hard flaccid is, guys, I've made several videos. You should check out my videos on hard flaccid above. I also have an entire hard flaccid course where I take you everything through step by step from workup to diagnosis. And honestly, a lot of that is applicable here as far as what you need to tell the doctor, what papers to look up and work up. So if you're interested, the link is in the description below. For all my guys doing PE or enlargement activities out there, what do I think you need to be aware of? So I think if you're having pain in your taint after doing any kind of PE, especially by pumpers and clampers out there, especially those things like clamping that can make you more prone for pelvic floor dysfunction. If you have any kind of blood in your urethra or feeling like you have urethral irritation, meaning you have to pee all the time, guys, those are all symptoms of this chronic pelvic pain syndrome. Okay, so you need to be very aware of that, and you need to basically put a hold on everything and get your symptoms under control before moving forward. Anyways, guys, I know this wasn't the most sexy video. I learned a lot. I hope you did too. And I hope this more importantly helps somebody out there. If you don't mind, take a second, like this video. Please consider subscribing to the channel if you like what I do. If you want to look for ways to support me and also supplements that can potentially help you along your journey, please check out the links in the description below. Anyways, guys, I appreciate you. Remember, there's nothing wrong with self-improvement, but you are enough just as you are. All right, guys, peace and love.
Dr. Hank got the plug on the health, yeah. Got you thinking about your wealth, yeah. In his office, no stealth, yeah. Pinnacle of that below the belt, yeah. Checks and balance, he's managing. Working miracles, no damage. Got you covered, no panicking. Stay calm. In the clinic, no vanishing. Yeah, with Doc Hank, it's the way back.